Hi everyone, my name is Karina Arias. I am a researcher from the University of Santiago of Chile, in where I lead a research project on studying intermunicipal collaboration. Under this project, we have collected data related to formal agreement established among municipalities located in the metropolitan area of Santiago during the last decade. And amidst the unfortunate scenario posed by the coronavirus pandemic, our team focused on the examination of this intermunicipal agreement related specifically to emergency management with the aim to portray the formalized structure of collaboration or the planned emergency management network at metropolitan level. Simultaneously, we apply a survey to municipal officials to explore in the contingent collaborative response in the context of pandemic, which can be understood as the actual emergency management network. The paper that I am presenting today is the result of this work of this comparison. But first, why study intermunicipal collaboration to deal with emergency situations? Well, first, because disaster and public health emergency often exceed a single jurisdiction and are seldom contained with a single city or local government boundaries. In this scenario, the public authority is fragmented and the need for collaborating becomes fundamental. Secondly, local government as the first contact between citizens and government have considerable responsibility in ensuring that their communities can deal with any kind of disaster. However, many municipalities lack the administrative capacity in terms of resources and specialization to implement an effective disaster policy in line with their responsibilities. So, a potential solution to this dilemma is to build collaborative relationship, collaborative networks to maximize the agency capacity and address mounting concern regarding the emergency. The effectiveness of those networks, however, is directly proportional to the operation and functionality of these collaborative relations. In this context, our research question is how effective are those formal intermunicipal agreements in the context of the pandemic in the Santiago metropolitan region of Chile? We use a network approach, and under this approach, current research has measured effectiveness of emergency management by comparing the network characteristics associated with the planned network versus the actual ones. And that's mean that in an emergency event, participants are expected to establish ties in accordance with plans. However, this doesn't not always happen. This gap reveals information about the effectiveness of emergency management network. This method has been mostly used to study networks involving mandate authority, in which these authority are expected to be the central actor in networks given their coordinated role. Marking a difference, this study focused on intermunicipal self-organized planet network. Given that this network rests on horizontal relationship characterized by autonomy and voluntary nature, there are no theoretical expectations about who should be the key actors in the network structure. This innovation in the operationalization of the planet network allow us to incorporate characteristics of the Latin American context where intermunicipal mechanisms has been promoted since the 90s. So in this context, the process of data collection involved two stages. First, to describe the planet network, we use archival data collected from official transparency website. This data consisted on those formal agreements established by municipalities during the last decade, which include a clause defining the will to collaborate in emergency situations. Around 16, agreement envisaged collective action in the case of disaster or emergency. Second, information about the actual network was obtained through an online survey of different municipal officials. We emailed the survey to 200 municipal officials over the course of 1 month, and we obtained a 36 response rate, and this response represents 96% of the total municipalities in the Santiago metropolitan area. We use a network analysis to analyze the effectiveness of this emergency management network. And in particular, the study measure and compare the network properties, including measure of density, centralization, and fragmentation. And in addition, we use measure of centrality to identify powerful and important actors, and that is degree centrality and betweenness. With this process, we obtain this result. We show in here the planning, emergency management network, and the actual ones. And from this picture, we can see the measure of the whole network also. So we can see that the actual network is denser, less centralized, and less fragmented than the planned one. This indicates that the emergent network is more cohesive than the previously agreed upon by municipalities. The actual network response comprises a large number of interactions, which are mostly informal and emergent interaction. In the emergent network, the power of individual actors vary widely across the network, indicated a loosely coupled network. And this emergence response network is less fragmented. That means also that it's more complex because it has more active participants and relationships. The second table shows the measures for degree and betweenness for each of the top 11 municipalities with higher score in the planning and the actual network. In the planning network, 2 municipalities are the central actor and they have the greatest betweenness. These municipalities are located in the central urban area and are among the wealthier municipalities, not only in the metropolitan region, but also the country as a whole. From a resource dependence perspective, we can suggest that municipalities with fewer resources and less agency capacity may be more interested in formalized collaborative relationships with wealthier municipality as a way of ensuring resources in the context of an emergency. But in the actual network, 5 municipalities are central actors and have the greatest betweenness. These 5 municipalities are among the poorest in the Santiago metropolitan region and are located in the rural areas, which means that they deal with deeper social vulnerabilities. And additionally, these municipalities share a history of collaboration with similar partners, forest and rural ones, in the form of traditional municipal association. According to this finding, we suggest that the municipal contingent's collaborative response may follow a more social criterion based on trust developed among those with a shared history of collaboration and vulnerability. So, with all these resources, we can say that the planning emergency management network established among municipalities to deal with the coronavirus pandemic was not effective in their response because only a few of the formal agreements were activated to coordinate the municipal response to the emergency. In fact, actual interactions went beyond the pre-planned agreement, incorporating new actors and new interaction outside of the scheduled procedures. So, as a whole, this network reflects a more complex emergency response, denser, less fragmented, and less centralized. So, in the uncertain, stressful, and chaotic environment of a disaster, participants may not follow expected behavior. In the present study, the gap between the plan and actual network reflect difference in the type of central actor. In the planned network, the key municipalities are those with more resources and higher status. And um, this suggests that actors with fewer resources and less capacity seek wealthier partners to ensure resources in the face of an emergency under a logic, an instrumental logic. By contrast, in the actual network, the central actors are those that have actively participated in traditional municipal association and thus share a history of intermunicipal collaboration, suggesting an embeddedness logic underlining the patterns of interaction. Well, these results can be used by policymakers and public managers to incorporate more traditional patterns of interactions, of collaboration, as a key actor in the emergency management um, system, and in this way, improve the phase of disaster preparedness. But for a scholarly point of view, this article also contributes develop a conceptual approach to the operationalization of planned emergency management network on the basis of this self-organized network and horizontal relationship. In this context, there is no theoretical expectation can vary in different ways. So to measure effectiveness, the identification of the set of voluntary agreement on emergency management serve as innovative way of capturing the planned network structure for comparison against the actual network. So these are the results of this paper, and thank you very much for this, for your attention.